This is the facet joint. You may have heard from your pain specialist or seen on your MRI or x-ray that you have facet arthropathy. That means you have arthritis in this joint. These are the joints on the back side of the spine that connect one vertebra or bone in the low back to another. Over time, these joints can get arthritis, just like your hips or your knees. Usually when patients come to see me, they're complaining of achy pain in the morning when they first wake up in their low back. And if they're doing a lot of twisting or bending, like if they're vacuuming in the house or sweeping, or if they're out doing yard work, they'll get a lot of pain. Now, it's important to know that pain from facet joints is usually just in the low back. It usually does not radiate to your legs. When I see this in my clinic and I get imaging and see it on MRI or x-ray, typically I'll recommend conservative things like physical therapy and anti-inflammatories first. Sometimes I'll recommend heat or ice. Ice is better if you've been outside or inside working and the pain has gotten more intense. Heat is usually better first thing in the morning when you wake up and it's really achy. If these things don't help, then sometimes a lumbar radiofrequency ablation can be helpful. So each of these little joints has a nerve supply that goes to it that sends signals to your brain to tell you that there's arthritis in the low back. First, what we do is under x-ray, I put numbing medicine around the nerves that go to the joints. Typically, that numbing medicine lasts somewhere between 2 to 8 hours. So during that time window, I would expect the patient's pain to get a lot better if this is the problem because the nerve to that joint is no longer sending signals. Now, what sort of pain relief am I talking about? So during that time frame, I want to see 70, 80, 90, or even 100% improvement in their pain. If they get that, then you can do an ablation procedure where this time under x-ray, I put a special needle by that nerve, and after it's numbed up, I put heat through the needle that creates a burn in the nerve. Now, the nerve goes through a process called Wallerian degeneration, which is a really fancy term to say that the nerve can no longer send signals. That usually lasts for about 6 to 12 months.